Yeah, that's so true. So, how about when you see a new patient, what do you ask them? What do you look for? Let's use me as an example. And I'll tell you a little bit about, my history with ortho and can you just do like a tele-dentistry and give me your opinion?
Well, my first question is, what do you need me to do? What's your problem? What's wrong?
My problem is my bite. My right side pops and clicks when I don't have my Myoaligner in. And I had history of ortho. So I told you at about age, I think I was third grade when I had my tonsils out to help me breathe better. And at about age 12 or 13, I had palatal expander because my canine was coming here, so probably had developed a narrow maxilla. So because of the crowding, they put me just in the palatal expander, nothing on the bottom. But then we moved to US and I didn't follow up for a while. I went to dental school. Then I started braces again when I was then in dental school. So
one of the things that I always question, most of my patients have had ortho before, some of them twice. Just because you had ortho doesn't mean it was finished.
Yes.
Okay. You had expansion. Did you have enough expansion?
No, definitely not. Definitely not.
Not have enough.
I stopped.
That's usually the case. That's usually the case. As far as the mandible goes, you can't expand the mandible.
No.
You can upright. Okay. You can upright, which is usually what you're going to do. So that's kind of what's going through my head. Okay, when somebody's telling me they had ortho and they had this, that, and the other, I'm thinking, okay, there's probably not enough expansion. Then I'll look and let me see what I see. In my head, just because you have buccal overjet and overbite doesn't mean you have proper expansion or a proper bite. You can have a dental occlusion that looks normal with a skeletal crossbite.
Definitely.
So I look at the jaws and I look at the placement of the jaws. If you look at your patients, a lot of them have midline deviations, correct?
Oh, yes.
If you line that up, you just put them in a crossbite. Dentally.
Dentally, yeah,
Dentally.
not skeletally, yeah.
Now you have a skeletal crossbite. It's just now you've unlocked it.
Yeah.
Okay. So that's the first thing I look at, I'll do a complete exam. We'll do a complete workup. I need to see the numbers. I need to see skeletally where you're not postural. That's important too. Now that came later. Okay. All this other airway stuff, I mean, in the 70s and the 80s and maybe the 90s, nobody really, we heard about posture. We never really thought about posture.
No.
So that really started, I'd have to say that almost really didn't get serious until 2000. Okay. I mean, maybe later.
Yeah, maybe later. I think later. 2000, I was going through LVI. I don't think there was much
emphasis didn't have
on
much
posture or airway. Not even airway. I don't think I was hearing airway at LVI.
Yeah. Well, I don't know. If you were taking straight wire courses, you would have had airway. I don't think LVI was into the ortho.
No, they weren't at that time.
They were more cosmetic and restorative.
Well, I mean, Bob Jenkelson was teaching there full time. Clayton Chan was there. Norm Thomas was there.
Now Clayton Chan, I think he developed an ortho curriculum at LVI, but that didn't happen till later. That was later, a while after he was there.
Yeah.
So until you have those, the orthopedic stuff, you're not really going to hear about, and the airway you're not really going to hear about.
I see.
And you know what? Kudos to them. They finally got it. Okay. So, but yeah, it's always, which surprised me a little bit because, I mean, like I said, airway's been around a long time. But as far as you go, I definitely do a workup. I think as far as your neuromuscular position, you probably conquered that as far as phase 1 goes now.
Yeah, I've been in Myoaligner, so you can see my posture, facial posture now.
Let's see, bite. Smile.
Well, let me take this out.
Okay. Okay, now just smile as big as you
Oh,
can.
look at this.
Nope. Towards me, though. Look at me and smile. Okay. All right. Yep.
And you can see how detailed it is. So with TENS, I haven't done K7. I have all K7 scans, but not done it on myself. So this was only on a TENS bite.
Okay. If you're going to go through ortho,
Right?
yep. Yeah. Now let me see. Just bite like that, but put them both in. Let me see. Put them both in. Okay. Now just bite. Now there you go. That's way better.
Wait,
But if you're
yes.
going through, yeah, if you're going through ortho, you don't really need a K7 bite per se at this point.
Oh,
What
really?
you did is fine.
You can do.
While you're going through ortho, I'm going to K7 you.
Okay.
There's about 4 spots where we stop and bring the patient back. I call it an ortho progress, K7 evaluation. And what I'm doing is I'm looking and seeing and driving towards trajectory.
Exactly. See,
Okay?
yeah.
We're creating where I think it's going to be based on all I can do for that patient.
You do just a scan 5, or you still do your sonography?
The first time I'll do everything.
Pardon me?
The very first time I do everything.
Oh, okay.
Okay. Very first time I do everything. Then down the road, I'll definitely do a 13. I do a 2. I like to make sure they're opening straight. And then I'll do a 4-5.
Okay.
Okay. That's the biggie.
Yeah.
And that's kind of that's where me and my orthodontist communicate about that.
I totally agree with you that in phase 1, especially with the removal orthotic, I know if you're doing a fixed orthotic going into restorative, yes, go ahead and do K7 scans. But I think in phase 1, because it changes so much, the body's still not in correct alignment. The patient just started treatment. My patient's still going through chiropractic. They're still going through myofunctional therapy. I think just a good TENS bite is enough for an appliance like this. And the dentist can just continue to equilibrate, as the body changes, and then go to ortho, and start expansion, and then do your K7 scans. That's when you start your K7 scans.
You can't treat neuromuscular ortho without it.
Yes, yeah.
There's nothing wrong with doing a full K7 workup if you want. Depends what you're looking for. I guess
to establish the beginning, to establish the pathology, that's a great value.
Right. If you have a patient, if I have a patient who's has if their issue is more dental versus cervical, cranial, what you're doing is fine. If I got a patient who's having cervical issues and they're ascending problems and they're in a lot of pain, I got to do the whole thing. All right. Once I do that and I get them comfortable, then we move forward. Then we move into ortho. Now, if it's
you're doing your K7 scans in that stage to decide if it's ascending or descending?
No. I already know that. If it's an ascending problem, if their problem is strictly coming from dental, ortho issue, go ahead and do what you're doing. Okay. If they've got postural issues and they're ascending and they're decent, you're going to be chasing that thing forever. Okay. Now I'm going to do that first true phase 1. I have to.
Which is an orthotic.
Yes. And you correct the posture and everything.
Yes.
Then you can go ahead and do
it.
But
every patient that we get has ascending issue. Every patient is posture.
But what's primary?
I mean, if you have occlusion, you cannot have malocclusion, you cannot have a perfect posture.
But what's primary? Where did it come from?
Either way, we have to treat both at the same time.
We do. I agree. We do.
Yeah.
I guess if we put it a different way, were you in any pain? Or was it just clicking and popping?
No, I was in pain, headaches. Yeah.
Okay. Headaches. So how long have you been in your Myoaligner?
3 years now.
When are you going to start ortho?
Well, I was waiting for Dr. Tennant to join my practice, so she just did.
Okay.
I do everything in house. I do not travel to, but
You didn't expand anymore yet?
no, I think we're gonna take my CT scans, but I think I'd like to expand the upper a little bit and then catch up the mandible to it. Yeah, I definitely need it.
You can start on that right now.
Yeah, with just an upper expander. Yeah, and keep my Myoaligner for daytime.
Yeah, you can do it. You can get going.
And then with anything, even with so, and then takes K7 scans, make sure I'm in the right place. Right,
Definitely.
that would be you do.
Yep.
Okay, before we just put the final wires and brackets and.
Yeah, I mean, when you're doing restorative, it's like you got to do it. Here's your bite, you take it, whatever, and you do it.
Yeah.
In ortho, it's going to change on you, man.
Yes.
So as long as you're moving in the right direction, which is what you're using it for.
Yeah.
You have to, and like I said, there's four stops along the way where they come and see me, and we go through it. So, but you could do it TENS, that's fine, as long as everything's in order.
Well, we would love to learn more from you, Dr. Fraschetti. We'd love to, we like to, through Myoaligner, I'm trying to bring more awareness to dentists, so at least they can help those 30-40% patients that in their practices, are suffering from TMD. Our goal, mission at Myoaligner is to at least introduce them to phase 1 with a simple TENS bite and a non-invasive, orthotic. And then, but we need help, from instructors like you, then to train, other practitioners to take over phase 2, because that's where the difficulty comes. And we hope that you can help us, get there. And
they always said phase 2 is where the rubber meets the road.
I know. So yeah, we really appreciate what you've done. All your career. I know you've impacted thousands of lives, and it must feel good. It must feel good.
You young people are the ones. You got the torch now. You got to run with what you guys are doing is great. I mean, I watch what people are doing and what they're posting. I'm like, man, I think I had that much energy 25 years ago.
I think you sent me that text.
I think I had that much energy. Oh, but it's you guys that are carrying it to that next level.
Thank you.
So you're building on what we're doing, what we have done.
Definitely. We have giants like you that we can stand on your shoulders and just carry that torch. Thank you.
Yeah, but don't throw out the old stuff either. I mean, there's sometimes you do have to go back to it. Sometimes you have to. Yes. Doesn't mean you can't use what you're doing. It just may not be at this moment in time.
Yes. Yeah.
Okay.
Yeah.
Airway first. Develop the arches. Neuromuscularly anyway, in the best way you can. And you'd be surprised if you can get those two things done, you're off to the races, man.
Yes. And not only dentally, and you can just impact your patient's life, their whole breathing back to, because you will make breathing easier for them. You will allow them to breathe and be oxygenated and hopefully survive up to 120 years, because that's the key. As
I know for a fact in your office, any neuromuscular office, you're going to get patients that came in ortho or are in active ortho, and they're like, I feel my jaws being pushed out of position, and they'll tell you. They tell you that what's happening.
They have dreams of drowning. They mention that. Yeah.
It's true, and they know. They're living it. So, but yeah, 36 years. I don't know. We'll keep going, I guess. Keep going.
Before we end this session, I don't want to take your time much. What is your during this pandemic? What is your recommendation to people? What is one key solution that you can give them to keep themselves healthier and their families healthier?
Stay healthy, and that means getting checked up. You don't put off health. Mm-hmm. Okay, I don't think we're going to get shut down anymore. All right, the patients that are coming in to see me and see us are very grateful we're open for them.
Yes.
So don't whatever you're listening to, don't put your health off. get it taken care of. All right. A broken tooth, decayed tooth, and extraction can set this whole process into motion.
That's
okay.
so true. Yeah.
It can. So to tell somebody, and I think this is wrong, to tell somebody to wait and don't go see the dentist. I mean, honestly, well, I'm not going to say it, but you know what?
This
That
is
ain't
my
cool.
life, so
That's not cool.
that's not cool. That's not cool.
That's not cool.
Yeah.
But yeah,
Staying
that's all
healthy.
my advice is don't put off your health. And
Yeah.
you're right, you know, we're not going anywhere.
Yeah.
You know, get it taken care of. Get it looked at, get it taken care of. There's help available. And every dentist that I've talked to, Dr. Mack, you know, we all are very accommodative. We can get a patient in and not expose them to anything.
Yes.
Okay. It's available. So don't let people fear that. It's not the way it is.
That's so true. And
So yeah, don't
remember
put
to
off,
breathe.
you know,
Everyone needs to remember to breathe through their nose.
breathe through your nose.
I know that's one of your number one recommendations because that's so important, especially guys, especially
I
people
mean,
that go to public or.
you know, distance runners are taught to breathe through their nose.
Mm-hmm.
Yeah, no, when they're training and running, that's their regulator.
Yeah.
That's what they try. Well, there you go.
And people need to remember they need to breathe in with belly out, not belly in.
Mm-hmm.
Get
Use
that
your diaphragm, man.
Yes. Get that nice air in.
Oh yeah.
Well,
Oxygen's here for a reason.
exactly. Let's use it as
Don't waste it.
now.
Yeah, don't waste it.
Well, thank you for joining me.
Thanks for
today.
the interview. It was very enjoyable.
Thank you.
I hope you know it helps somebody, and you know someday maybe we'll get together again. maybe we can actually have a course.
Yes, I know. I'm looking so forward to it. Yes, and that's
I'm going through all my old stuff,
you
know, and putting courses and actually putting different courses together. You know, all the stuff I've had over the years. I'm kind of putting it into a pearls thing and
perfect.
go
Yes.
from there. You know, I hope I get to show it someday.
There, yes, we're actually we have set the foundation for launching Myoaligner Academy as of January 1st. So, you know, if you like to teach some of our advanced courses, we really appreciate it.
Hey, I'd love to.
That would be.
I got some time on my hands now.
There you go. We can always do Zoom, you know, it can all be online, you know, for a while until we can get back to our new normal.
That's one of the benefits of being us old guys. You know, we work 2 days a week and then we figure out what to do for the rest of it.
Yeah.
Oh, I love taking the online courses now. It's like, oh, okay, I can cut my grass and listen to the course at the same time.
Yes, or barbecue and listen to the same
Yeah.
course.
I kind of like that concept, you know, it's not a bad deal.
Yes, it's wonderful.
Driving in the car, you know, me and my wife are listening to a course. It's great.
I know. Convenience. Technology brings us convenience and disaster at the same time.
But you still need some hands-on. I mean, you're still going to need that.
That is so true.
Somewhere along
I totally agree with that. Yeah.
Well, keep me posted about the academy.
Okay, sounds
And
good.
then, we'll stay in touch, and
Thank you.
everything's going good. And it's a pleasure hearing from you.